thank you so much for taking the time to do this. If you could please just introduce yourself and your line of research in relation to Parkinson's and movement disorders.
So I'm Andrea Pilotto. I'm professor of neurology at the University of Brescia. We built up a multidisciplinary team for following up Parkinsonian patients, but more broad neurodegenerative disorders in general. And so our main lines of research are, on one side, biomarkers for evaluating the different phenotypes of Parkinsonian patients, and also digital markers to track the efficacy of management strategies, pharmacological, but even non-pharmacological. And then the other line of research is indeed understand whether non-pharmacological strategies can achieve or improve different outcomes in Parkinsonian patients and also in neurodegenerative disorders.
So when you speak about non-pharmaceutical strategies, I assume that's where the dance comes in, right?
Yes, because we know that the drugs are important for Parkinsonian patients, but they are just a part of the treatment. And we see with the same drug and with the same treatment regimen, completely different responses. And we know that physical activity, cognitive activity, rehabilitation, but also socialization and arts and music and dance come in, then they can have a really important impact, probably even before. And so in modulating the risk of developing neurodegenerative disorders.
And have you observed some specific impacts from Dancewell on the people of Parkinson's and their family members?
I was impressed by my first Dancewell session because the specificity of the Dancewell program is to include different aspects. Of course, dance alone can improve a lot of different aspects of movement disorders, but I feel that Dancewell, of course, can give more broader impact because there is no difference between patients and caregivers. So you are a community. So you are a small but important social group with new interactions, and again, with no difference between treated and non-treated patients. And the people participating, they are not treated, they are participating to an activity, and this is very important, and this makes an important difference between Dancewell and physiotherapy or focus group just for patients. This can be really an added value. And then arts and beauty, this can be another very important specific value, because we know that the regions connected to the imagination and to arts, they are using part of the dopamine and or of the Parkinson vulnerable regions, but they are using even more broader part of the brain. And with the Dancewell, we can then stimulate or enhance these systems. And we see this with different approaches, and it's very interesting impact from both pragmatic evaluation of movement, but also from well-being, quality of life, and motivation, self-awareness of the body, which is another very important aspect. Also for neuroscientists, this can give a lot of ideas, and I agree with the original idea that Dancewell is more than a dance practice, is really a program with a concentration of different aspects, and this is very important and beyond the paradigm of patients, but I think for the community of patients, caregiver, and healthcare providers.
It's inspiring to listen to the language you give to it, ranging from breaking the rules to enhancing quality of life. It's a wonderful description from your perspective. I really appreciate hearing you describe it. And I'm curious about two more things. You spoke earlier about multidisciplinary approach to research. Can you just explain how you see multidisciplinary research?
From an healthcare provider perspective, we now know that Parkinson disease and Parkinsonian patients need not just a clinical approach, but different approaches and different specialists. And we know that this comprehensive healthcare multidisciplinary approach is indeed very important for improving the awareness of the symptoms and how to deal with them and counteract even, and then also to provide the patients and caregiver new instruments for improving their lives and facing with different problems. The multidisciplinary approach is not only beautiful, not only important because we have guidelines, but it is really a need. And we are, as a community and as specialists, also trying to explain to the healthcare systems in Europe, but beyond Europe, that this slow medicine approach, because it's also important, it's the only way to provide a sustainable approach for chronic diseases. And of course, it is not that easy in this kind of economy-based medicine to provide evidence that disease even cost effective. This is not that easy, but we should, as a community, also explain to the healthcare system that economics is not the only way to evaluate what we are doing, and that we need to be heterogeneous, but have a very clear idea and a very clear way of going together, explaining that multidisciplinary approaches are pivotal if we want to have a very beautiful life altogether with different kind of chronic problems. We are all aging, and so we need to provide new solutions for our lives and for, again, from brain health. Also, the general community should understand that it's important if we want to have a happy community and also to deal with possible problems like Parkinson's disease.
I have one last question for you. How do you imagine, or can you imagine, some specific ways that dance artists and scientists might collaborate together on research?
So I'm particularly curious for that, and we already started some studies evaluating different aspects. So one important aspect are the psychological and neuropsychological changes before and after, or even during the sessions of Dancewell. We know that Dancewell, again, can enhance probably different parts of the brain linked to imagination and linked to beauty and even social living. And so evaluate these aspects through imaging or neuropsychological assessment is very important. And another more technical aspect is which are the changes we can track during the sessions and after the sessions. And this is very important to demonstrate that Dancewell, and we want to demonstrate that Dancewell even more than a common dance applied to a group of participants, can improve the way we are moving, because we are using a different kind of circuitries and networks, and so probably we are forgetting that we are patients, and so we are using a different way of movement.
They're making me think of two things that I've observed inside of the dance world classes, which is it's almost like practicing courage to move in new ways, gaining courage to try out different ways to move, and this sense of belief in oneself, the self-efficacy aspect is one that I witnessed that allows for a lot of new movements to happen inside of the dance world classes. And it's an area of research I've been very curious about, of how to kind of document or capture that that capacity, that ability, what's gained in the perception of ability to move, and then how that experimentation or creativity around movement might extend, beyond the class and throughout the day.
We could even explore which is the impact for healthcare providers and caregivers to be part of a group, because I think this is underestimated.
I totally agree with you, 100%.
And in different ways, so you understand better your relatives or your patients, but also you put yourself in a different way to them, and I think this is very important for a lot of healthcare providers. So some of my co-workers, some physiotherapists, sport medicine specialists, they were part of the group, and they were enthusiastic in general, but they also had new ideas and new way of evaluating the disease and the problems, and also the solutions.
And not to even mention the impact probably for them as well of what happens when you're working with people that have degenerative or progressively degenerative diseases, and not to mention one's own personal capacity to process all that. So I think there's also personal benefit that comes to anyone who's joining in whatever role. So yeah.
Completely agree.
Yeah, thank you so much for your time. Enjoy the rest of the day.
Yeah.
Bye.
Bye.